And what we have found is that disease-free survival, so no recurrence, cure for the patient, is not impacted by the sinus. But if you relapse, the survival after relapse is clearly impacted by the sinus, and right-sided tumor, as previously described, are of poor prognostic. When looking at sinus and the effect of the anti-EGFR in RAS wild-type patient, because anti-EGFR do not work in RAS mutant patient, what we have seen is that you have a positive effect of cetuximab in this purified patient, which is not significant but better than chemotherapy alone, and this is true in right and left, so there is no predictive value neither. But surprisingly, as the patients were very well characterized, we looked in different molecular groups of what is happening on recurrence by sinus. And the first point is MSI-MSS is exactly the same, no influence of sinus on DFS. But if you look at BRAF mutant and KRAS mutant, it seems that having in this mutant population a right-sided tumor is a good prognostic factor, which is very surprising and has never been described before. At the contrary, if you look at the double wild type for BRAF and RAS, you have a bad prognostic of right-sided tumor, which is more usual. So now we will have to understand in future study, because it's a huge set of patients of 1,809, almost 1,900 patients. Now we will have in future studies or preclinical studies try to understand why this mutation make the sinus associated to different prognosis.